So my sincere thanks to our organizers and Professor Sudhakar Rao garu for giving me this opportunity. So, oxymoron is a word which is a combination of two words which mean differently, opposite meaning. Organized mess, these are the examples. Friendly fight, original copy, virtual reality, small crowd, open secret, only choice. These are the opposite meaning but are in the same word. One more such word is, it's a joke, don't take it seriously, happily. And ethical marketing, that also looks like a oxymoron. There are ethics, there is marketing. Can they go together? The word ethics means defining and recommending concepts of what is right and what is wrong. Good business and good ethics do not have to be mutually exclusive. We can be ethical and we can still market in a proper way. We must keep in mind ethics code of the medical profession. We must not denigrate our colleagues. We should respect them. We should not criticize them. Must use a message which content should respect the dignity of the profession. Special attention should be paid to the language which you use, and we must be, our messages or our promotion should be truthful and should not create unjustified expectation or should not create fear in patient's mind. We must be able to provide the services which we claim in the advertisements. So we should not advertise which we cannot provide. And promotion by mentioning the success rates is also considered unethical. Ethics requires that any paid advertisement should be identified as such. We cannot put advertisement as a news item. So ethics says, what is ethics? Whatever we do or whatever we tell, it should be beneficence, doing good, non-maleficence, no harm, justice, ensuring fairness and autonomy, giving the patient the freedom to choose correctly. So National Medical Commission has given directions regarding marketing. What are unethical acts? Chapter 6, soliciting of patients directly or indirectly by a physician or by a group of physicians or by institutions or organizations is unethical. A medical practitioner is, however, permitted to make a formal announcement in the press regarding the following. So we can advertise on starting practice, on change of type of practice, on changing address, on temporary absence from duty, on resumption of another practice, on succeeding to another practice, on public declaration of charges. Printing of self-photograph in the letterhead or signboard is unethical. It is improper for a physician to use unusually large signboard and write on, if anything other than what we should mention on our signboard: name, qualification obtained from a university or a statutory body, titles and names of specialty and registration number. Only these things should be mentioned on the board. The same should be mentioned on the prescription papers also, nothing more than that. It is improper to affix a signboard on a medical shop or in places where we do not reside or do not work. So this is one of the most aggressive advertisements I have seen. Marketing. So how can we market? We can give paper advertisements, especially on our anniversary functions, or if we have started new service, or if we have appointed a new consultant. On such occasions, we can give paper advertisements. On similar occasions, we can give TV scrolls or ads. We can put a flex or banner on specific occasions at our hospital, not on the roads. Glossian boards without photograph can be put near our hospital. We can join service organizations like Lottery or Lines or Chamber of Commerce. Chamber of Commerce is not a service organization, but it gives us exposure. Our name becomes familiar to many important persons in the town, and thereby we'll indirectly get benefit from that's the indirect way of marketing. Then we can conduct service doing a lot of free camps. So we can do free camps, we can do service, and simultaneously we get a good name, and indirectly we get more patients. And we can create awareness programs like glaucoma awareness program or eye donation awareness program. So these programs will take us into the public, our hospital or our name will become familiar, and we'll get more patients. And getting accreditation like NABH and other. Is my time over? My time over, sir? So in-house advertising. So in-house we can slightly go overboard because we are not seen outside. So we can have brochures telling about our hospital, the diseases, explaining the diseases, surgeries performed in our hospital, or regarding the type of implants offered. These things can be given in the brochures. Consultant's profile can be exhibited in the hospital. Accreditations like NABH and other accreditations can be exhibited in the hospital. The equipment you have purchased, the services you are offering, this can be exhibited. You can have a good big size screen, and you can project hospital tour videos or surgery videos so that patient will get impressed. And our counselors, if you train them properly, they will do good marketing for us. And we can go, these days we can go beyond traditional marketing, but we should be watchful that no false, deceptive or misleading information is given, no misleading omissions, no appeals to the patient's anxiety, must not create unjustified expectations. We must disclose the risks, we must not misrepresent the credentials, and no unsubstantiated claims of superiority above others. So we can do online advertisement. Online reviews are very important. Some studies say that 80% of the patients watch the customer reviews before attending. So if you find a negative feedback about your practice, you dig in and address the issue. Every negative review and comment is an opportunity to improve. Respond to both negative and positive reviews. Make sure that you have notifications turned on so that you will be seeing the reviews regularly. And you can use Facebook, Twitter, X, Insta, like social media marketing. It provides easy access to our address, phone numbers, our web address, messaging address. And we can use search engines. The star rating Google gives you from your online review is a key measure of your online performance. Everybody searches Google before going anywhere. Practice with less than 4 stars will be filtered out of best search awards. So if you are having less than 4 stars, your name will not come in the best hospitals award. Having a higher volume and more frequency of reviews will increase your rating. You can create a YouTube channel to bring awareness of your brand. You can make YouTube educational videos. You can advertise through the other YouTube videos. You can use YouTube to increase your brand visibility. There are online provider directories. We can enroll in it. It gives free publicity to us. And don't forget to include a link to your website in that books. So emails, you can regularly send emails to your database regarding quarterly reminder for glaucoma patients or half-yearly reminder for diabetic retinopathy patients. And whenever you send a reminder by email, make sure that there is a call of action for booking an appointment or contacting. Use blogs where you can you can go even deeper and loads quickly. Your website should work on mobile, and it should load very quickly, and it should be easy to use. Offering detailed information on your consultation staff, conditions, etc. will help the patient in deciding to come to you. Ensure that your website is near the top of the search engines. On the website, in the website, you can provide the information about your consultants, office location, contact details, etc., patient testimonials. And there should be one-click contact button for mobile users so that they will be able to book appointment. So I have explained many things which we can do, and I admit that I have not done, most of them I have not done. So what I did in the last 25 years, I am telling you. First thing is payer mix. Apart from cash patient, we can have many other patients. Insurance, like we can get empaneled with star insurance and insurances. Third-party administrators like Medi Assist and all. And so because they advertise for us, they advertise our hospital's name on their website. So patients go, I mean, when they take that insurance, they will come to us, patients. And we can have corporate tie-ups. So the companies, they will send their patients, their employees for regular periodical medical checkup. And you can take up government schemes like Employee Health Scheme and Arogya Sri, which will generate a lot of revenue for us. And if you are competent and confident, you can encourage medical international tourism also. And your staff are your best advertisers. Take care of your staff. It's a wonderful photograph, sir, you have shown about your staff. It is so pleasing. Take care of them. Take care of your staff. Keep them happy. Keep them well groomed. Keep them well trained. Keep them motivated. They will help you to spread your practice. And above all, word of mouth. The best advertising is done by satisfied customer. All the new forms of marketing brought about by new advertising technologies are on the rise. We cannot underestimate the power of word of mouth. The end goal is not to just increase revenue, but to establish a human connection between the physician and patient, ensuring a good experience. And most important is treat the current patient well. If you treat this patient well, if you make him happy, he will bring more patients to you. Create a attitude of servitude. So patient should be satisfied in terms of service delivery. And Hippocratic Oath captures all these features. Treat the sick to the best of your ability, do no harm, work within your scope of practice and training and not beyond your expertise. Always place the patient's interest above your own, maintain absolute patient privacy, be respectful to colleagues. If you follow this, that itself is a good marketing for you. Thank you for this opportunity, sir.